A key to a safe reopening for the economy is a safe and adequate service on the MBTA. A report card on those efforts and some recommendations for improvement were recently put out by the transportation advocates at A Better City. To tell us about them is its project director, Caitlin Allen-Connelly. Thank you very much for being with us, Caitlin.
Thank you, Chris.
Caitlin, I want to start out with the report card because there are some things that need improvement, but there are some things that you think the T is doing pretty well. Start with the things that the T is doing well. What are these?
Absolutely. So first and foremost, I believe the MBTA is doing the best job that they can. It's a very difficult situation, and I'm very appreciative of all the efforts. At the same time, there are peer agencies that are doing better. But what the T has been doing well has been implementing best practices around cleaning and disinfecting of its vehicles and its stations, as well as workforce management practices to keep its operators safe.
Well, keeping us safe, I imagine that means things like personal protective equipment.
Yes, so the T has provided personal protective equipment, whether it be face masks, health checks, and previously had instituted a rear door policy, boarding policy, and best practices like that.
Well, now that you mentioned that previous policy of entry through rear doors or middle doors, the T is going back to entry by the front door, the normal way. The T says it makes sense to do it, but what do you think at this point?
So I think that we've seen across other peer agencies, like in Chicago and Philadelphia, and in August, the MTA looking on Chicago and Philadelphia have already resumed front door boarding. So I think that it makes sense. The other agencies that are doing that have layered on measures of social distancing or physical distancing that protect the riders, like markers on the seats to tell people where to sit. So I think they've also installed barriers across all of the buses and the vehicles and on the subways to protect the operators. It's my understanding that the T has done that, but I don't know for sure whether or not all of the buses have actually seen that installation.
Well, before the pandemic, crowded buses and trains on the T were normal, at least during peak hours, and it was always my assumption that crowding was hard to control, at least beyond scheduling. So what about now that we're supposed to have all this distancing between people? Is the T doing enough to control that?
So I think the T is making steps in the right direction, but I don't think, that is doing enough. The other agencies across the U.S., as I said, have installed decals or markers to allow for physical distancing, whether it be on the ground in stations to help tell people where they should be standing when they're on the platforms, or inside of the actual vehicles where seats are blocked off and there are indicators for where people should and should not sit. The T has instituted capacity limits on the bus lines with they're using the 3 feet standard, which is actually the European World Health Organization standard and not the CDC suggested 6 feet of physical distancing, as sort of their temporarily redefined crowding definitions, which they're not enforcing at the time. They did just institute a new real-time crowding app, which is monitoring right now. I believe it's 24 bus lines. It provides information on crowding over not crowded, some crowding, and crowding, along with sort of real-time information about when the next buses are going to come. I definitely think this is a step in the right direction. We've done a quick analysis to sort of see on a daily basis at the new peak hours how things are going, and sort of a very quick snapshot is that in many cases around 53% of the buses are going out with some level of crowding. That's based on the 3 feet. If you were to use the sort of CDC guidelines, there would be more buses that would be crowded on that. But I do know that the leadership team is getting a report every day from the crowding information and assessing that. And they do have some operational flexibility, but I think because we're still seeing crowding and people don't appear to be wearing face masks, that we need to do a little bit more at looking at what the headways are and increasing and potentially redeploying buses to the high transit dependent and high transit demand bus routes.
Well, if you're going to have a standard distance of just 3 feet, you certainly want everybody else in the bus to be wearing a mask. What about, you mentioned, you said not everybody's wearing a mask, and how easy it is to get a mask. If you walk into a station, you left your mask at home, what can you do?
So that's a very good point. I think that's another place where the T instituted a 2-week pilot to give out masks at 4 stations during the peak hours, but it was just for 2 weeks. And I think that we're seeing in Europe and in other peer agencies across the United States that face masks are being available free of charge to passengers who are coming in and don't have one. It's sort of a soft enforcement, if you will, but allows the passenger or the rider the opportunity to have one if they don't have one going into the station. And I think that's incredibly important when we think about what the CDC is saying now in the most current research around transmission. Indirect transmission is sort of being seen as a lower risk, where person-to-person transmission is seen higher. And when a person is breathing, when they wear there's this like 3 feet. If a person coughs, it's like 8 feet. If a person sneezes, it goes up to 25 feet. So that's where, in my view, a sort of the layering on of best practices is where you're going to see the best results. It's not just one particular best practice that an agency puts in place, but it's a whole suite of them, looking at sort of the overall public health risk.
Of course, another factor here is, especially during the summer, people are in vehicles where the windows aren't open. Some of them might be new vehicles with great ventilation and air conditioning, but not all of them are. So what does that mean for riders?
So that, again, that's where when we take those factors into consideration, and there's definitely public health risks, it's seen as a potential to be a hotspot. Of course, passengers are, there's many different factors that relate to the sort of that risk on public transit, which have to do with the age and the health of a person, the density in terms of crowding, the amount of time a person is on a train, the type of station they got on, if it was an outdoor like a Green Line or indoor station, that those things do have a factor, but in some ways it's hard to exactly pinpoint whether or not public transportation is the vector, right, is the cause of it. But this is why it's absolutely important that face masks are made available and that we continue. One thing I think that is lacking, and I do give credit to the MBTA for putting in place the Ride Safer campaign. In my view, it doesn't go far enough. It's not in multiple languages. It's on their website. And I'm not sure if there's sort of community outreach that's going on in the languages of those communities to help sort of raise awareness around the basic practices that riders have a responsibility to sort of take on, and what the transit agencies in terms of their responsibilities. And I think creating a social compact of sorts, or the shared responsibility, will help us to see better results and sort of compliance overall. You see that in Europe, for example, in France on their transit system. There's a very large and widespread campaign about this sort of shared responsibility and an openness and transparency about what exactly it is the transit agency is doing and what exactly the expectations are for the rider. And you see that, like in the CTA, they have a lot of signage in their stations about the fact that there are decals on the platforms, in the vehicles, what that social distancing or physical distancing distance is. SEPTA as well, shows icons of the seats that are blocked off, the face masks, and I know the Ride Safer campaign has some of that, but I think further action on that part will help to sort of socialize this absolute imperative of people doing, empowering themselves, protecting themselves, but also protecting other riders, in particular in the summer, as you said, when potentially the windows aren't open and there's not a lot of airflow.
Well, right now, we're in the phase 3 of reopening. It could take several months before we get to phase 4. You want the T to have a comprehensive plan going forward. What would that have to include that we don't have already?
Well, I think the comprehensive plan, what we've seen so far, has been a very iterative process. And in some ways, I can understand that because we are it's something very unprecedented, and we've never been through this before. But there are other agencies that have put out comprehensive plans by phase to show exactly what the actions are going to be on the part of the transit agency, as well as the expectations on the rider. So what I think I would like to see more from the MBTA would be to expand on the 2 pages that were in the governor's reopening plan around mass transit, and to really phase out and be much more transparent about ridership, about what crowding, what's happening in terms of crowding. And then a lot of the agencies have sort of one page sheets that are easy to understand and digestible. They're very user friendly, and to date I haven't seen those from the MBTA, and I think that would be incredibly helpful, obviously in multiple languages and across media. I mean, personally, I would love to see an indicator in the Boston Globe, for example, or other media outlets that are talking about, what's the ridership like, what should we be doing to protect ourselves, talking about a little bit more frequently, potentially in the governor's updates, so that the information has a larger audience than just a person going to the website. In a discussion with the MBTA recently, I was asking about metrics in terms of monitoring the crowding app, and it's difficult, I think, for them to disentangle what information people are actually seeing. They have seen an uptick of about 20% of people going to their website, but it seems to correlate with the increase in ridership. So it's hard to tell.
Well, we should finally mention that if there's anything new coming out from A Better City, is there some way that people can find that online?
Sure. So we'll be continuing to monitor what's happening. We're looking at the crowding on buses and the ridership, and trying to sort of find some more detail there to be able to provide guidance to the riders. We've done a number of different reports. One of them in a series called the Commonwealth Commutes, that provides information and practical advice for the rider on how they can protect themselves when they are commuting, from wearing a face mask to not eating to washing your hands. To me, there's really a trio. It's wear your mask, distance, and using hand sanitizer. And those are the 3 most important things, I think, for a rider to protect themselves and to sort of be aware where they're placing themselves, even with that distance. Maybe they don't want to necessarily be downwind of a person. So those reports we have going the distance, which provides a great deal of detail around the different recommendations from the CDC and the WHO. But we'll definitely be continuing to monitor this, and we really feel that safety should be 365 days a year on public transit. We shouldn't have to wait for reopening, and the people who are riding the transit right now mostly are essential workers. About 56% are transit dependent, and we know that essential workers, in terms of the demographics, many are women and people in communities, Black communities and Latino communities, and there's already a disproportionate sort of impact of COVID-19 on these populations. So I think we shouldn't put these riders, these heroes, in a position where they have to choose between access and safety. They should be able to have access and safety at the same time.